Welcome to Spark and Shine.
Nausea and vomiting, also called morning sickness, are common during pregnancy, especially in the first trimester. In this video, let's discuss about the 10 commonly recommended tips that some pregnant mothers find helpful for managing nausea and vomiting during pregnancy. It's important to consult your healthcare provider before trying any new remedies. Tip number 1 is to eat small, frequent meals. Instead of 3 large meals, try eating 5 to 6 smaller meals throughout the day to keep your stomach settled. Avoid an empty stomach by eating every 2 to 3 hours. Opt for light, easy to digest foods like crackers, toast, or dry cereal. Tip number 2 is to stay hydrated throughout the day. Drink plenty of fluids, but in small sips throughout the day. For this, you can sip on water, clear broths, or herbal teas throughout the day. Sometimes cold beverages or sucking on ice chips can also help. Try ginger tea, lemon water, or electrolyte-rich drinks to keep you hydrated. The third tip is to avoid trigger foods. Identify and steer clear of foods or smells that seem to worsen your nausea. Strong odors, spicy foods, and greasy meals can make nausea worse, and avoid taking them to prevent nausea. The fourth tip is to opt for bland foods. Foods like crackers, toast, rice, or bananas are often easier on the stomach. The fifth tip is to have ginger. Ginger has natural anti-nausea properties. Including ginger in your diet helps to relieve morning sickness. Many mothers find that ginger tea, ginger candies, or ginger supplements help reduce nausea. The sixth tip is vitamin B6 supplements. Vitamin B6, also known as pyridoxine, is known to help with nausea. Always check with your doctor before starting any supplements and for the right dosage. The seventh tip is to get adequate rest. Fatigue and stress can worsen nausea. Make sure to rest whenever you need to. And consider short naps if possible. Try relaxation techniques like deep breathing or meditation to relax your mind. The eighth tip is to avoid overly rich or spicy foods. These foods can irritate the stomach and may contribute to nausea. Tip number 9 is to wear loose, comfortable clothing. Tight clothes can add pressure to your stomach, worsening nausea. Wearing loose, comfortable clothing helps in preventing morning sickness. Last tip is to get some fresh air. Open windows or step outside for fresh air, especially if you feel nauseous indoors. This dramatically improves your nausea. Bonus tips. Bonus tip number 1 is to try acupressure. Some find relief with acupressure wristbands like C-bands, which may help reduce nausea symptoms. Wristbands designed for motion sickness can help with pregnancy nausea by applying pressure to the P6 acupressure point. Bonus tip number 2 is to keep a food diary. Tracking what you eat and when you feel nauseous can help identify patterns and potential triggers to avoid. This helps to avoid the triggers and thereby prevent nausea. Last bonus tip is to include high-protein foods like nuts, yogurt, cheese, or boiled eggs in your diet. They surprisingly keep nausea away and help stabilize blood sugar. Remember, every pregnancy is unique, so what works for one person might not work for another. Always discuss these strategies with your healthcare provider to ensure they're safe and appropriate for your health condition. Good luck.